Symptoms of typhoid fever begin after an incubation period of 8 to 18 days. The natural history of the disease roughly follows a 4-week course. During the first week of illness, typhoid fever classically presents with a, quote, stepwise fever and pulse temperature dissociation. Stepwise fever refers to a fever that gradually becomes more and more intense with each subsequent day, while pulse temperature dissociation denotes the presence of relative bradycardia despite high fevers. During the second week, abdominal pain and rash develop. The rash is typically described as, quote, rose spots, or salmon-colored macules on the trunk. During the third week, disease severity reaches its peak as the bacteria disseminate from their point of entry in the ileum to Peyer's patches, or lymph node nodules in the ileum, to the liver, spleen, gallbladder, and bone marrow, which can result in hepatosplenomegaly, intestinal bleeding, and perforation. In extreme cases, encephalopathy, septic shock, and death may occur. During the fourth week, symptoms improve and eventually resolve over the course of weeks to months. If left untreated, typhoid fever carries a mortality of greater than 15%. However, with antibiotic therapy, this number falls dramatically to less than 1%, and many of the aforementioned complications are avoided. This slide shows a graphic representation of the, quote, stepwise fever classically seen in typhoid fever. This slide represents, quote, rose spots or salmon-colored macules on the trunk, which are characteristic of typhoid fever.